Good morning or good afternoon, and welcome everybody to the March edition of the CPSI National Patient Safety Collaborative. I'm happy to say that we've got about 45 lines online with us today from coast to coast, so that's great. Just a little bit about the Patient Safety Collaborative for those of you who may not be members. We meet every month at this same time via teleconference, and it's the fourth Friday of each month, and I hope that's what today is. The third Friday of each month, sorry about that, at the same time, and it's an open collaborative, and everybody is welcome to join. So if this is your first meeting joining us, welcome, and feel free to join at any future time. So today's topic is going to be quite interesting for all of us. The first introduction that CPSI made to social media in terms of what it can do and provide for us was introduced at the 2011 CPSI conference, where the concepts and the potential that social media can offer us was broached in a very interesting and interactive session at the CPSI conference. So we've been trying to follow up that to say, how does that apply in the patient safety realm within the CPSI grouping? So I'm delighted to have our speaker with us today, and Abhizak Saraga, sorry about that, is with the Canadian Patient Safety Institute, and he is with the Web and Social Media Manager, and he's responsible for the Institute's website and social media efforts. In his social media role, he has helped to jumpstart the @PatientSafety and @SafeCare Library Twitter accounts for CPSI, the Canadian Patient Safety Institute, along with CPSI's Facebook, LinkedIn, and YouTube pages. So if you haven't been to any of those, I'm sure he would be delighted for you to hop onto those as well. He's had previous marketing experience with companies such as BizBash.TO, MrFranchise.ca, and Micralyne. I probably moshed that up as well, .8. So he's joined CPSI in 2009 as web coordinator, and on his own time he operates www.glutenfreemolten.com, a celiac's guide to gluten-free living in Edmonton. And Abhizak joins us today from Edmonton, so without further ado, I'm going to turn the presentation over to him. Please, as Lisa said, type your questions in as we go along, and there will be time at the end of the presentation for a question and answering session. Abhizak, over to you.
Hi there, everybody, and thanks for having me. I'm just going to I guess Darlene just kind of went over my first slide. So yes, I am currently the Web and Social Media Manager at the Canadian Patient Safety Institute. And I do have 10 years of marketing and communications, and as Darlene said, it's kind of across the realm from media publication, which is BizBash Toronto, which is located in Toronto. I've worked in MrFranchise.ca, which is just marketing and franchising. I worked for a social media startup company called FreeMyTeam.com, which was a sports management tool. And here I worked for Micralyne, was that company name that you're trying to pronounce. It's a local high-tech company here in Edmonton that produces nanotechnology. I was their marketing and communications associate that was in charge of all their digital marketing, including their newsletter, where they're advertising, finding places, finding the right media channels to advertise, which trade shows to advertise in, and of course their website as well was responsible for. As I said, I also blog at glutenfreeedmonton.com. That's because my wife was diagnosed with celiac disease in 2009. It was actually just a week before our wedding, so she determined to eat her wedding cake and then go on the gluten-free diet. And I decided to document our experiences, kind of finding all the resources and what it's like to be living the gluten-free lifestyle. And I do get her to blog because she herself is the patient and she's going through more of the experiences than me. So we found that I kind of did it as a hobby. I really like working in social media, and I kind of get her to get involved as well, like I said. And it turned out quite well. We get about 11,000 page views a month, which we're very excited for. We're getting a lot of good information out to people. When it comes to CPSI social media presence, I've really helped build it up to be quite a reputable online presence when it comes to patient safety materials. We do tweet out a lot of information on our programs, events, and news in general. You'll often see what we call, internally we call it today's news. So our communications officer collects all of today's news from all the news sources, and I do tweet out all that information because it's very valuable information for our audiences, and we do find that people like that. We do have about 1,900 followers on Twitter and just over 500 followers on Facebook. And a bit about more of me and CPSI. So I do manage these 6 websites, which are all part of CPSI. There's actually a 7th, which is our communities of practice, which I kind of, I guess, left off, and it's kind of being redeveloped as well. So there's the first one. Let me try this pointer. So this first one is our main corporate page. It houses most of our funded research, our tools and resources like the Canadian Disclosure Guidelines, and our education programs like the Canadian Patient Safety Officer course and the Patient Safety Education Program, and plus news and events. So a lot of the news that we read up on, we write about in events like Canadian Patient Safety Week and Canada's Virtual Forum on Patient Safety and Quality Improvement. Then there's Safer Healthcare Now website, which some of you may be familiar with. It's actually an initiative of CPSI. It kind of hits the front line in a lot of our measurement. It has about, I think, 8 different interventions, including falls prevention, medication reconciliation, and so on and so forth. And a big part of it is measurement as well. Global Patient Safety Alerts, which is a tool and resource that came out of CPSI. It has, I think, 600 plus global patient safety alerts and recommendations and actions to reduce risk from 16 different contributing organizations from across the world. It's a great repository and tool to use. The Improving Care Search Center itself is just a search tool. It's a healthcare dedicated search tool with 600 healthcare websites indexed. So you're going to get really good healthcare results. So when you search for AMI, you're going to get results on acute myocardial infarction instead of some random stuff that Google may spit out. Patients for Patient Safety Canada, it's just a group that is part of CPSI. It's a patient group that we support. And then handhygiene.ca, which is an intervention of safer healthcare now. And it's going to be kind of part of the focus that I'm going to be talking to you about today. So a bit more about me. So like I said, I'm also responsible for the social media. What you're looking at here is what's called a social media dashboard. This is one of many programs that are available. This one's called Hootsuite. Some of you may have heard of it. Some of you may have not. This is a great way for me to be able to monitor the social media and just kind of see what's happening, what's being said, see what we're saying, what people are saying about us. I'm able to kind of aggregate all the information that's coming in because obviously there's a lot of information coming across social media, so I'm able to really segment all that information quite well. So now a little bit about the Canadian Patient Safety Institute. We were established by Health Canada in 2003. CPSI works with governments, health organizations, leaders, and healthcare providers to inspire extraordinary improvement in patient safety and quality improvement. And why do we exist? Well, it's because the Norton Baker study that some of you may be familiar with, there are 24,000 deaths a year in Canadian hospitals. And so that's why we're here to help to prevent these deaths and prevent injury by creating awareness and developing tools and resources. So a little bit of overview of what I'm going to talk to you about today. I'm going to go over the video competition, the hand hygiene video competition, how we launched the campaign, how we leveraged other communication channels for this, what this all meant for us, and some of our lessons learned. So how it all began. So we're the Canadian host organization for Stop Clean Your Hands Day in May that coincides with World Health Organization's Save Lives, Clean Your Hands. Last year, it's typically on May 5th, and this year it's going to be on May 7th. So if your organization's facilities haven't signed up, please visit handhygiene.ca and sign up for Stop Clean Your Hands Day. So last year was the third year we had run it, and we're looking to inspire some creativity in delivering awareness, and decided to run a hand hygiene competition. So you may ask, why is hand hygiene so important? Well, in Canada, healthcare-associated infections affect more than 220,000 people every year and kills 8,000 to 12,000. So hand hygiene, a very simple action, remains the primary means to reduce healthcare, which is just cleaning your hands. It's very simple, and we wanted to be able to raise awareness about this simple action that can reduce the healthcare-associated infections. So the purpose, like I said, of this competition, to raise awareness of proper hand washing methods. We launched the video competition during Stop Clean Your Hands Day on May 5th. We launched it at Brant General in Ontario. Brant General was the inspiration of this competition, and the reason why is that they had created their own hand hygiene video called I Want to Wash My Hands. It's a video that went viral, and to this day it has about 47,000 views, which is fantastic. So that was really an inspiration for us, and that's what really got the fire started. And I'm going to actually just show you that video right now.
Hi folks, I'm Jim Hornell, President and CEO of the Brant Community Healthcare System, and I want to talk to you for a moment about fighting disease and infections in our organization. And I want to talk about a very simple and effective way of making sure that doesn't happen. It's about washing our hands, probably the single most important thing that you can do to help fight infection in our organization. Hand washing is very serious, but as an organization we're confident enough that we know that we can deal with this serious issue in a fun way, and that's what this video is all about. It's having fun and taking care of a very serious matter. So folks, let's get busy. Let's get washing our hands. I want to wash my hands. Good luck.
One, two, three.
Oh yeah, I'll tell you something I think you'll understand, 'cause I do the right thing. I want to wash my hands. I want to wash my hands. I want to wash my hands before I touch a patient. I'll make those microbes scram. When I take my gloves off, I want to wash my hands. I want to wash my hands. I want to wash my hands. And when I touch you, I feel happy inside. You know my hands are clean, those germs, they can't hide, they can't hide, they can't hide. Oh, please say to me, you want to lend a hand. Oh, please say to me, you want to wash your hands. You want to wash your hands. You want to wash your hands. What's that? You wanna wash your hands. You wanna wash your hands. You wanna wash your hands. And when I touch you, I feel happy inside. You know my hands are clean, those germs. They can't hide, they can't hide, they can't hide. Oh, scrub for 15 seconds. There ain't no better plan than you'll have that something. Healthy, germ-free hands. We wanna wash our hands. We wanna wash our hands. We wanna wash our hands.
So I'll stop that video there. As you can see, it was quite a fun video, and obviously after the Beatles song. And quite an inspirational video, and you might have seen some guest appearance cameos by Walter Gretzky and even the Health Minister in Ontario, Deb Matthews. So it was great to see that type of support and as well. So so from there, you know, we decided to launch our video competition. What did we get out of our video competition? Well, we launched it and got just over 1,000 votes casted on which video that they liked the best. 54,000 post views on Facebook, which was way up from anything we've ever had on Facebook, because we find most of our social media activity and interaction engagement comes from Twitter. We actually doubled our Facebook followers. We had about 1,300 comments on the whole hand hygiene, on all the hand hygiene videos since October 1st, which compared to previously, we basically would get no comments at all on our Facebook page. Almost 3,000 views of all the videos on Facebook, which is fantastic. It's great spread and awareness of hand hygiene. 550 views on YouTube, because we posted it both on YouTube and on Facebook. And we didn't promote YouTube, so that 550 is just from people searching for hand hygiene videos, and so we were able to get those videos out to those people, and several dozen clicks combined from all of our tweets. And the tweets we're sending out were to promote voting, to promote submitting your videos, and everything like that. So for us, it was quite a successful campaign, and we were very happy that we went along with it. We received videos from across the country, and this is one that was certainly one of our favorites, certainly one of my favorites. This one came from actually the housekeeping staff at the Mammonoid Geriatric Center in Quebec. So I'm going to show you this one now. And once again, this is another song, and this was, I guess, a remix of a song.
Yeah, you know what it is. Soap and water, soap and water, soap and water, soap and water. Yeah, you know what it is. Soap and water, soap and water, soap and water, soap and water. Yeah, you know what it is. Misses and the stars, we do it big. Yeah, no, we stay washing. Michael stand to your hands, sanitize. Soap in our jobs every day in life, you know we use soap and water, soap and water, soap and water, soap and water. We do our part, not spreading germs, all because of soap and water, soap and water, soap and water, soap and water. H2O and soap. Sanitize the only way you do it, bro. When you get respect, you gotta keep your swag clean. Never know who's gonna shake your hand or kiss your cheek. Shout out to my Maimonides, Dino Berman. Clean hands on my staff, I'm high-fiving. Take it for a fact, self-confidence really does start with good hygiene. Quote that. Estimated wash time is the length of singing happy birthday. Did you know that? Use warm water for the most part. Pump soap, push to start. Yeah, you know what it is. Misses and the stars, we do it big. Yeah, no, we stay washing. Michael stand to your hands, sanitize. Soap in our jobs every day in life, you know we use soap and water, soap and water, soap and water, soap and water. We do our part, not spreading germs, all because of soap and water, soap and water, soap and water, soap and water.
housekeeping staff. We some part-timers, making sure the residents get the soap required. Step 1, gotta rinse your hands now. Step 2, apply the soap and rub it well. Fingertips in between every inch, front to back. Rub it in, rub it in, rub it in. Dry hands till you wash them down later. If you in public, close the tap with hand papers. You know what it is. Mixers and the stars, we do it big. No, we stay washing. Micro sand to your hands, sanitize. Ripping our jobs every day, and like you know we use soap and water, soap and water, soap and water, soap and water. We do our part, not spreading germs, all because of soap and water, soap and water, soap and water, soap and water. Doing my thing as a human being. Gotta stay fly, so fresh, so clean. Doing my thing as a human being. Wash your hands if you know what I mean. We gotta stay clean, we gotta stay clean. #1 rule for some good hygiene. We gotta stay clean, we gotta stay clean. #1 rule for some good hygiene. You know what it is. You know what it is. Shout out Mr. Rosen. I hope you feel the Montreal Planetary spirit out there in Connecticut. Team Extension 226, we do it big. Spreading germs all because of soap and water, soap and water, soap and water, soap and water. You know what it is. Mixers and the stars, we do it big. No, we stay washing. Micro sand to your hands, sanitize. Ripping our jobs every day, like you know we use soap and water, soap and water, soap and water, soap and water. We do our part, not spreading germs all because of soap and water, soap and water, soap and water, soap and water. Camera shots courtesy of.
I'm going to stop that video there as well. And what I really like about this video is it not only is it showing the proper hand washing method, but it's showing how everyone's involved in hand hygiene, from like the housekeeping staff, which actually put this on. So that's why I really enjoyed that video. And obviously it's a catchy hip hop song that they redid into that. So kind of really good. So now on to kind of how we launched this campaign. So this really is, and social media is really all about the people, and same with patient safety itself. It's all about the people and raising awareness and getting people involved. So we did turn it to the people, and we made it kind of a viewer's choice award. So we wanted to get all these entries, and instead of just having us choose which video was their favorite, we kind of went both ways with it, and we wanted to let the people choose which video they liked the best. With it. So we posted, we thought Facebook was going to be kind of the best mechanism to do that, because when you post stuff on Facebook, people can like the video, and that like kind of ends up to be a vote, and it also makes it easily accessible for a lot of people. Mainly everybody's on Facebook. We understand that there are organizations that do block Facebook, but we know in general in their personal lives they are on Facebook, and so it just seemed like the right thing to do, and it's easy to share the videos with your friends. So we thought that spread was going to go around, and that's really what happened. When we posted the videos on Facebook, you can see, I don't know if you guys can see on your screen how well you see it, but I have a screenshot there of one of the videos in the comment stream. So there's 53 comments on this particular video that I'm actually going to show next, but you can see the comments saying, awesome video, Sharon, love it, well done, Sammy. So you can see that kind of that viral thing was happening, and people were sharing with their friends, and their friends were commenting, and their friends were passing it on as well. And that's what we really wanted. It was spreading the word of these videos, and people were watching these videos and just getting the message, whether they knew that they were getting the message or not. They were getting the message that about hand hygiene. So we really did like that aspect, and we thought it really worked out well for using Facebook for this type of campaign. So now I said I'm going to play this one. This was the runner-up video. It was from here in Edmonton. It was the Royal Alexandra Hospital. And I think this one was inspired maybe because Alberta is home of WestJet, so this kind of has an airline feel to it. So it's much different than the other two videos that you just watched.
In accordance with infection control standards, we have prepared a safety video for your enjoyment. We are pleased to welcome you aboard this unit. Your safety and your patient's safety is important to us. Your infection control crew is responsible for your well-being and that of your patient. Please do not hesitate to ask any one of us for assistance. If you have any concerns, please let one of us know. For good workplace health and safety, lighter baggage should be stowed in the overhead compartment. We ask for your attention as we outline the safety features of this unit. Please follow along with the simple instructions on this safety card. Hand gel dispensers are located here, here, and here. For added safety, sinks are located here, here, and here. Please note the one nearest you. You will be required to use it during your shift. In preparation for patient care, your hands should be clean, making sure that you pay attention to the wrists, the thumbs, and in between your fingers. Clean hands are required at all times, especially when caring for a patient. If at any time during your shift you are required to help more than one person, remain calm, breathe normally, and be sure to wash your own hands first before helping or assisting with another patient. If you come in contact with blood or body fluids that do not belong to you, clean your hands, strap on the appropriate PPE including gloves, before you dispose of the bodily fluids in the hopper. For added safety, remember to clean your hands after removing gloves. Also clean your hands when removing gowns. Clean your hands after each piece of PPE, including face protection. When your hands feel or look dirty, using hand gel would be an unsafe maneuver and should not be used. Say no thank you to hand gel. We ask that you return to the nearest sink immediately and wash them with soap and water. Gloves may be required when caring for a patient. The removal of gloves without performing hand hygiene will cause your infection control personnel to become depressurized. Always clean your hands after the removal of gloves. Everyone's safety depends on it. We hope you have enjoyed this video. Patient safety is our top priority. Thank you for choosing safety first. Bye-bye.
So again, a really good video shows about hand washing methods. I think it followed the four moments and kind of really whimsical way of showing it. So I think that one worked out well, and that's why it garnered some of those votes. Let's bring it back into the presentation. So I talked about that I'm going to go over some of the communication channels that we leverage. So one thing about social media, you can't always just put something out there and just, I say you can't set it and forget it. There's sometimes more work involved to make sure that people notice. So we did have some mechanisms that we did use to show these videos and garner support for them. So for one thing, we had a captive audience at Canada's virtual forum on patient safety and quality improvement. And this year it was held October 31st to November 4th, in 2011. And that's during Canadian Patient Safety Week, and that's when we announced the winners. So during this time, we had 2,000 attendees to this virtual forum from, I think it was like 16 different countries. So they were already watching the forum, so we're able to show these videos and really make it part of the whole experience of the virtual forum, and then get them to go on to Facebook themselves and vote for their videos. So we thought that was a great way to kind of showcase all these videos that came in, because there were such great videos that came in. We used our email marketing tools. We have a really engaged audience. In my experience, through my 10 years of experience, I usually say that a 2 to 4% click rate on your emails is really good, but we get about an 8 to 10% click rate on our emails, email marketing campaigns, and that's just absolutely fantastic. considering the amount of emails that people do get bombarded with a day. We continually use our Twitter and Facebook messaging, interacting, reaching out to other organizations to go and place their votes and visit the Facebook page. And of course, word of mouth, and not just us telling people, but having the organizations that submitted tell their people, tell their friends, tell their colleagues, tell their office mates about it. Our communications officer would send out a couple of emails during the campaign, just reminding them that tell all of your workers, tell all of your friends to go and vote, because that's kind of part of the whole thing, to spread the message, for people to share all that information. And that's what kind of made it successful. As you can see, there was like 50 comments on one, another post, another 50 comments. So people were sharing the videos, and we find the more people share the information, the more garnered support that kind of item really got. So now what you've all probably been waiting for, I hope, is the winner of the hand hygiene competition, which came from Ontario, is the Chatham-Kent Health Alliance in Ontario. I'm going to play that video now. And once again, this is another kind of different video than what you've seen. This one's more story-based, and it's kind of really fun and whimsical.
This just in. The villainous Mrs. A has escaped. She's up to her infectious ways, spreading MRSA to everyone and everything she contacts. Who can stop her? Who can save us? What can anyone do? Time will tell.
The supervillain Mrs. A has escaped.
If she comes to Chatham-Kent Health Alliance, she could spread her bacteria through poor hand hygiene and direct and indirect contact with patients and staff in the environment. She could cause a massive outbreak.
Oh no. There's an outbreak on Zone Z.
Poor hand hygiene is the cause for this outbreak. We must investigate.
Chatham-Kent Health Alliance. We had a good discussion. I think from my perspective, one of the things I have to be mindful of is we've done business intelligence.
Last week, we had a presentation on business intelligence use of stuff.
We have a problem.
Marie, we're the infection control team here at Chatham-Kent Health Alliance. These are my partners. So you're a physiotherapist.
Where were you at the time of the outbreak?
Seriously, where were you during the outbreak?
Well, I was washing my hands for 15 seconds out in the hall before entering the patient's room with alcohol-based hand rub.
How do you know?
Because it was one of the 4 moments.
Doc, tell me your whereabouts and activities at the time of the outbreak.
Look, I'm innocent. I want a lawyer.
Look, Doc, we have proof. Mrs. A, aka MRSA, is on the loose.
Look, I swear, I took some alcohol-based hand rub and I washed my hands for at least 15 seconds before I even put my gloves on to do the aseptic procedure. I swear I'm innocent. I didn't do anything.
So you're a nurse?
Yes.
Tell us what you were doing at the time of the outbreak.
After the body fluid exposure, I disposed of my gloves and washed my hands for 15 seconds in soap and water.
You did?
Definitely.
So let's take this from the top. You were cleaning the room, and then...
I was cleaning, and after patient environment contact, I took off my gloves, and I washed my hands with the alcohol-based hand rub for 15 seconds.
Are you sure?
I'm positive.
Is there anything else you want to tell me?
No, that's it, I swear.
CPSIA staff have performed hand hygiene effectively at all 4 moments for hand hygiene. That could mean only one thing. Mrs. A must be in the facility.
Look, Mrs. A has the means, she has the motive. All she needed was the opportunity.
Look, there's Mrs. A. I'll go this way.
We interrupt this broadcast for an important announcement. Mrs. A has been captured. CPHA has sterilized the area and is once again safe from Mrs. A, thanks to the infection control team and the CKHA staff.
Congratulations, team. We have stopped the spread of Mrs. A. CKHA has done it again.
A nice, really different way of raising the awareness. It was a great story behind it and everything. I'm going to get back into the presentation. So now on to the last part, which is the lessons learned here. So one was with audience engagement. So one of the reasons why one of the other reasons why we really wanted to use Facebook is that we really had low audience engagement on Facebook, and we wanted to kind of test and see how we can get increased audience engagement on Facebook. So we learned that although people, we're hoping to actually also increase our Facebook followers, and we did increase it, and we could have increased by more. We didn't realize that you didn't have to like us to like the videos, but we still doubled our Facebook followers, so that was great. But we had a lot more likes as well in general. But so we did gain those followers because we engaged the audience and brought it to the people. We did gain the followers that were actually interested in patient safety, and not just people that were friends as well of the people that might not have an interest in it, in the topic. So we did gain the right followers that we did because we did engage the audience and approach everybody. With social spread, we made it about the people, and we knew if we made it about the people that they would get involved. So we turned it to the users and asked them to reach out further into their community as well, and it worked. Because kind of creating video is kind of fun and exciting. It got that excitement there, and it kind of spread really well. And that the commenting streams on the videos kind of proved that as well. We did make a reward for it, a kind of extra incentive maybe for the organization to get their staff to do it. So we did give a $250 credit to our hand hygiene store. So the organizations had a vested interest for them to say, hey guys, why don't you make a video, let's have some fun with this. And once again, it all goes towards a good cause. And then retention. So campaigns like this are great, but continued action is required. If you just kind of go back to status quo, then your engagement levels will go back to status quo. So what are we doing to make sure the retention happens? Well, we're going to do it again. So we're going to have another video competition, this time on medication safety, and it's going to, we'll air the videos and have the voting at the same time during Canada's virtual forum on patient safety and quality improvement. So details on that can be found at patientsafetyinstitute.ca. It's going to run again during Canadian Patient Safety Week, which I believe this year is October 30th to November 3rd this year, or something like that. So it's just a day before, depending on the week. So and also for hand hygiene, this is actually the next step, which we're running right now. We ran what's called the Stick at the Hand Hygiene Sticker Design Competition. So some of you, I know the organizers, I know Lisa has been on our Facebook page. Some of you may have as well, but we just had, I think, about 30 stickers submitted for this competition, and we posted them on the Facebook at the beginning of the week. and we're getting people to kind of choose their favorites, and then the top 5 are going to be chosen by the planning committee to actually be printed for Stop Clean Your Hands Day, which is going to be May 7th this year. And so it'll be printed and sent out to everybody that registers for Stop Clean Your Hands Day. So I encourage you to visit handhygiene.ca, learn more about Stop Clean Your Hands Day, learn more about the sticker design competition, visit our Facebook, look at the sticker design and see which ones you like, give them a like, make a comment, and enjoy. So that's the end of my presentation. If you do have any questions, you can obviously type them in the chat box, or if they're going to open up the lines, they can certainly open up the lines. If you think of something after, give me an email. My email's on the screen. I'll give them my contact information. This Twitter account is one of my own Twitter accounts, so if you have any questions and you're on Twitter, you can certainly tweet me there. I also have another Twitter account for my blog. If you have any questions about celiac disease or gluten-free living, it's at GFreeYEG. And then for anything with CPSI, our Twitter account is patient_safety. So thank you, everyone, and let me know if you have any questions.
So there are no questions presently typed in. If anybody has any questions or comments or anything they'd like to share, if you've participated somehow or if your organization has done something similar, we'd be really happy to hear about it. If you have any other questions related to sort of ideals around how to use social media to promote patient safety, please type in your questions or put up your hand, and I will try to unmute your line. I don't know, did you have any comments, Darlene or Tracy?
It's Darlene. Yes, I'm just curious as to how you choose the videos. Do you just put them out there and leave them totally open up to voting, or did you have some parameters around the content and then left it up to, once they met the criteria, posted them and then opened it up to voting?
So for this particular competition, I think the 2 criteria was they wanted to promote just the proper hand washing methods as best as possible. So there were some that were non-healthcare related as well that we did leave in the competition because it was still promoting hand washing in different ways. So and all of them that we came in, we did post. There were actually some. There were a couple that weren't able to get up, and that's because they were infringing some copyrights. So they, like the one with the housekeeping staff, that was a hip-hop song, but they rewrote the lyrics, so it was fine. But there were some people that just played a soundtrack over it, and that one, both YouTube and Facebook wouldn't allow those ones to be posted. So obviously, those ones they were not able to be entered into the competition because it was infringing the copyright. But really, we didn't want to leave anybody out because people went through great effort to make these videos, and they were still all about hand washing and raising the awareness anyways.
Absolutely. Thank you. Just a question back to the audience out there, wondering if others have done a similar campaign, if anybody is interested in jumping in. You can type it on there, and Lisa can mute your line. One of the things that we grapple with here at the IWK is the whole idea of reinventing the wheel, and there are such great videos out there, and you've demonstrated 4 very different approaches to a very, the exact same topic. So we always talk about whether or not we need to invent our own and do our own and get greater buy-in that way, or is there just as much buy-in by linking to some others that are already out there? So I'd be interested in your thoughts on that as well.
Yeah, for this type of campaign, certainly what we liked about this one is that it came from other people and not us. So CPSI has a lot of credibility in what we do, but we also wanted to give credit to other people in the work that they do. And so that's why we opened it up for other people to create these videos. Certainly we've created our own videos for certain things, but for this one we just wanted to really make it fun and open it up to other people, because we know a lot of people have really good ideas as well, and we wanted them to share those ideas. So we thought it was a good idea to create the competition.
My co-chair is also on the line, Tracy, and I'm just wondering if Tracy has any comments that she would like to add, or questions that she'd like to send out to either our panelists or our audience.
No, not at this time, though. I think it's a really sort of an exciting approach to sort of generating some interest and really connecting with a particular demographic too. I think more and more, the more that we're using social media, the broader our scope will be. So that's sort of my only comment, and I think that this has been a really innovative way to actually to do that. So great job, really good work.
Thank you.
So Irene just has she says, sorry, I think I missed a question, re-copyrights for music used in the background of the videos. So if you could just explain that again, Avizek, about how. So
there was 2 videos, or at least one video that what they did is I forgot the song. It's the one Moves Like Jagger. So they basically had that soundtrack on top of their video. So that was infringing a copyright. So it just basically the system just said we can't post that video because it's infringing on copyright. So both Facebook and YouTube did that, but because the other one, the one from Brant Community Hospital with I Want to Wash Your Hands, the medley was the same, but it wasn't infringing the copyright because they really wrote their own lyrics. And same with the one with the soap and water one. That's a hip hop song called, I think it's called Black and Yellow or something like that. They rewrote the lyrics, so it wasn't infringing the copyright. So the systems, I guess the YouTube and Facebook have their own, detection software to make sure that no one's infringing copyright. So it kind of does that for you.
Excellent. Lisa, are there any other questions or comments from the audience?
None so far. Nothing here. I know that we're at CAFC here. We're just sort of dipping our toes into the social media world, and we have somebody on staff who's been pretty active in the Twitter world for us, and developed a Facebook page. So this is the first year that we've been more actively using the social media tools, and I think the Twitter world has really opened up a lot of things because it's so immediate, and we make a lot of really interesting connections with other organizations, and we get some information, very quickly, because I mean, if Twitter is right now sort of communication, not like we're used to in healthcare. So.
Yeah, that's very true. I find that for me personally, the difference between Facebook and Twitter, we do get, like I said, it's that kind of more instant engagement, and there's a lot more communication for us going on. There is a really large healthcare community on Twitter that's engaging with each other. With Facebook, we don't have nearly as many followers on Facebook, but we know people are still reading and clicking on the information we're providing on Facebook, but there's still more engagement in people retweeting our messages and responding to our messages that we're sending out, and more people clicking on our messages from there as well.
Abhizek, do you have goals or plans for the future of where you plan to take this beyond, some of the work that you've already shared with us today?
Social media is so young, and people are still trying to figure it out, and so we're trying to make it. We're always trying to find different ways to use it for any of our campaigns or any of our programs. And any of our initiatives, and it's really just trying to integrate it into everything we do. So like I said, right now that we stick to kind of our organizational objectives of awareness, and so that's what social media is allowing us to do. It's really just another media channel. It's another marketing channel, and so we're able to use that. And it's essentially it's free to use, so it's a great way to use it. And with being innovative, it's just, like I said, integrating it. We try to do kind of like the Twitter chats, participate in them, and get people active on what's called a hashtag, which is like a topic area. So for our conferences and stuff like that. So it's certainly trying to move forward and push forward with it, but it's an ever-changing landscape. There's always new platforms coming out, so always new tools to look at and platforms to use. Like right now, one of the hottest platforms is called Pinterest. I don't know if anybody's heard of that one now, and it's becoming very popular, and quite interestingly, it's amongst females. It's becoming very popular, and it's just it's kind of like a bookmarking site, and if you see a page or something that you like, you pin it to a bulletin board, a virtual bulletin board that you have, and it just takes a picture from that page and puts it on a board, and you can share these boards, and people find the boards and repin your boards, and it's become a very hot thing right now. And like there's just ever-changing landscape, always new platforms coming out. So it's just really keeping up, seeing what's happening, see where you can fit in, and seeing if these platforms work for you. So right now, for CPSI, I haven't really looked at Pinterest for CPSI. We've stuck with LinkedIn, Facebook, and Twitter, and YouTube. I've started to use a bit of what's Google Plus platform as well, a little bit of that too, to see how that works for us.
I think that one of the things within healthcare is that we are not known to be very nimble with changing with the media that's out there, or the mediums that are out there. By the time we have one figured out, we hear that there's something new out. So I take that point of how can we be as nimble as what the audience that we're trying to reach requires us. And do you have any words of wisdom around that?
Yeah, like every platform might not be for everyone. So if Twitter is what's working with you, then I would suggest stick with Twitter. If you see more, it's about with the environmental scanning. If you see more of your community moving towards another platform, maybe it's worth just checking out that platform, seeing what's on it. Maybe you don't have to do anything, but just be kind of just kind of look and see what's happening there, and you don't have to be that engaged in it, but it's worth researching something if you hear something's coming up, and see how you can fit in, if you can fit in, and if it's worth the resources for you to fit in. Like for me, Pinterest, I'm using it for my personal blog, because I do see people kind of using it right now, and it might work with some of that content, because I post recipes and I post restaurant stuff, and so I think that's of interest for that. But I don't know if it'll fit for CPSI's work, so I don't think I'm gonna go that way just yet.
Yeah, I have a couple of questions here. So there's one that says, do you use Storify? Which I don't know what that means myself, so maybe you do.
No, I haven't heard of that tool. If they give an explanation of the tool, I can maybe give an example of a similar tool that I might be using.
And can you explain hashtags?
So, okay, so for Twitter, a hashtag is what's called a topic. So, for instance, if I'm tweeting something about patient safety, within that tweet, which is 140 characters, part of that tweet that will be a hashtag of PT safety, which is a hashtag used for patient safety. And what that does is, in Twitter, it kind of you'll see a tweet and you'll see a hashtag, and that hashtag will be linked. And actually, let me see if I can. Whoops. If I go back to my social media dashboard screenshot. So you'll see my sent in let me bring the pointer. So you'll see there it's kind of highlighted there. So you can click on that, and when you click on when you click on that hashtag of PT safety, it then brings what's like a transcript of everybody that has said something about patient safety and has tagged their tweet patient safety. So you kind of get a conversation going, and you can follow a conversation. So I use PT safety. I use CDN Health, which is a hashtag used for Canadian healthcare. Hand hygiene is like that. This one, BCHC, is British Columbia Healthcare. So there's different ones, and there's researches. There is a website that I can send a link to that kind of shows a lot of healthcare hashtags that are being used, so you can know which ones fit you and some of the tweets that you may be sending out. What I do with this is called a social media dashboard. Like I said, I have these tabs which aggregate my information. So this tab is for patient safety. So when I click on that, you'll get similar streams like this, and I'll be able to sort them from, this stream will say everything that's hashtag PT safety, but at the same time, not everybody will put the topic PT safety, put the hashtag PT safety, but they'll just have the words patient safety. So I'll just do a search stream that says patient safety, and I'm able to get a good idea of what's being said about patient safety, who's saying it, and what topics are being brought up.
I have another question here. Thanks, Abhishek. So the Partners in Care Family Advisory at BC Children's maintains a Twitter account, a Facebook page, and a blog. It says we don't allow comments on our blog because of risk management concerns. We have gone ahead with a Facebook page and we moderate it. Did CPSI have similar concerns originally about moderation?
Oh, certainly. I think that's probably on the top of every organization's mind, moderating and allowing comments and not allowing comments. So I think everyone's scared about that. I think when you're endeavoring into social media or any plan, you kind of want a strategy put together, maybe working with a communications team to work with a contingency plan if somebody does start attacking you or saying untruthful things. Like you kind of want a plan in place ahead of time to know how to react to that type of situation and what to do. And typically one of the things not to do is you don't delete the comment, because typically it's been known to cause a bit more rage.
Now, is there, because I don't really know much about this, but so if you have a blog, and is there a way to sort of have people comment but it doesn't go publicly until you look at it before it can?
Yeah, different systems will have different settings. So on my CPSI doesn't have a blog, but with my own personal blog, I allow comments to go right through. But I get notified when a comment goes through, so I can read the comment, and sometimes it's just a spam comment that I'll delete. But you can have what's called I use Blogger. I use the Google tool, and you can moderate comments. So basically, you approve each comment as it goes through. It is possible. Okay. So if that organization wants to open up their blog to comments, maybe they want to do moderated comments, and it's just that every comment is approved before it goes through.
So Susan, does that answer your question about moderation? Or did you want a little bit more information about CPSI's strategy for moderation? Actually, Susan, I've unmuted you. I don't know if you're able, if you have a microphone on your computer, if you're able to talk. I guess not. So she's saying that yes, if you have any more to share on your strategy for moderation at CPSI, she would be interested in hearing.
I think my recommendation would be to speak with their, if they have a communications person, to speak with them, because really your reaction to that should be aligned with your organizational objectives and how your organization handles media, because it's kind of a similar realm. So it probably wouldn't be a good idea for me to say what we would do, because their organization might have different outlooks and different objectives for that, and how to deal with different situations. So it's probably a good idea to speak with them and just have that plan in place as soon as possible. This way, just if off chance somebody does have a comment or a negative comment or something hurtful, that you know how to deal with that. Because there have been good examples of how stuff is dealt, and you know, you can take stuff offline and speak to the person offline, which is one thing to do.
So it looks like we've reached the end of our time here. I might just turn things back over to Darlene at this point.
Absolutely. Thank you, Lisa. And thank you, Abizak, for enlightening us on what CPSI is doing. I think there's some great work there, and I suspect that after today's session you'll have a few more followers on either your Facebook or LinkedIn or your actually Twitter account. So thank you very much for this presentation on behalf of both Lisa and Tracy, myself, and all of the participants on the audience. And I just want to remind folks, I have made a little goof in the beginning. The 5 Fridays this month kind of messed me up a bit. We do meet as the Patient Safety Collaborative on the 4th Friday of each month. So I look forward to everybody joining us on any 4th Friday of any month in the future. So thank you very much again for this wonderful presentation, Abizak.
Thank you very much for having me, guys.
And just to let everybody know before you get offline that this has been recorded and we will be posting it on the CAFC Knowledge Exchange Network. So thanks very much, everybody, and have a great weekend.